Hello, my name's Dr. Claire Kay. Welcome to the BMJ Group series of patient information films. In this film we're going to be looking at cognitive behavioural therapy, or CBT, a type of psychotherapy or talking treatment. You can have CBT to treat mental health problems like anxiety, depression, panic attacks and obsessive compulsive disorder, OCD. Unlike other types of psychotherapies, it focuses on the here and now rather than the past, and it helps people look rationally at their fears and anxieties.
In terms of common psychological problems like depression and anxiety, there is no clear line between normal and abnormal. What actually defines somebody having a disorder or a significant problem is the extent to which it interferes with their life. The features of cognitive behaviour therapy are that it's very short term, that it's focused on the particular problems that people bring to therapy, and it's goal-oriented. It's actually about helping people to make changes that they want to change. It's also a message that other people sometimes give. So you're anxious, so you're depressed, get over it. The correct answer to that on the part of the patient or the sufferer is to say, yes, I'd love to, how please. Cognitive behaviour therapy has been particularly successful in the first case with depression, and then that moved into anxiety and panic disorder, for example. It's undoubtedly the first line treatment, and most people will get better from panic and agoraphobia with CBT.
Research shows that CBT works well for over half of people suffering from anxiety, and after a 12-week course, 7 out of 10 people with panic attacks stopped having them.
If you take something like obsessive compulsive disorder, then you find you feel a bit dirty and you want to wash your hands because you're a bit afraid of germs. Well, it's actually rather hard and a bit embarrassing to go to your family doctor with a problem like that, and so people postpone it.
Well, I've had OCD 24 years before I sought help, now 30 years. The fear was that if my hands were dirty and I touched something else, that would contaminate them. So the horror was of me causing somebody else a terrible illness, even death. On a bad day, I'd be washing my hands up to sort of 90 times a day. I was washing all the clothes that I was wearing on a particular day at the end of the day, including my coat. I couldn't invite people back to the flat. Social life, private life was a disaster zone, really.
In, for example, obsessive compulsive disorder, the first part of therapy involves helping the person make sense of what's going on and understand the nature of the problem. It then becomes quite practical. For example, someone who has particular fears is helped to confront those fears, not just feel the fear and do it anyway, but actually go into the situation, find out what's really going on, try and find a different way of tackling it.
The tasks I was asked to do in order to get there were extreme, and in one sense felt quite brutal, and they were things that people in the normal spectrum would never do, and so they were to cause, deliberately to cause my anxiety to go sky high, in order to prove that in fact nothing terrible happened.
We take things which people are avoiding and we get people to confront them in a really rather unusual way. So, for example, we might, after appropriate preparation, move to the position where people are deliberately contaminating themselves, putting their hands down a lavatory and then not washing their hands, eating their lunch and so on. And on the face of it, this is bizarre. And people sometimes say, well, that's very unnatural. Why do you do that? But that's rather like saying, someone's got a broken leg and the person saying, well, no, why should I have a plaster cast on? That's extremely unnatural. Nobody else has a plaster cast. And the idea is you often have to do things in a very different way in order to put them right.
Cumulatively, the therapy had a massive effect. I mean, very tangible things like not washing my hands 30 times a day, having, being given back 2 hours a day, basically, that I was no longer now spending in the shower or doing my laundry. I've actually gained years of my life that I would have spent continuously cleaning and washing. It was so energy consuming and so depressing. And so I not only had time, but I had hope and energy. And I began to think impossible things, like I could even invite people home.
For some people, the problem is fixed. That's it. It's gone. They're cured. For other people, particularly people who've had the problem for a very long time, then there's also a sort of repair job that needs to be done on the kind of secondary damage, on the damage that's happened as a result of the problem they've had. And CBT, in my view, isn't just about taking bad stuff away. It's actually about making it possible for people to reclaim their lives in terms of the good things that they want to happen. CBT is certainly not going to work all the time with everybody, but it just happens to be one of the best that we have, and it's very consistent.
You can also try a course of computerised CBT, but bear in mind most research has been done on sessions with therapists. Some people may initially prefer using a computer rather than talking to a therapist about private thoughts and feelings, so you might find this a useful introduction to CBT.